Let's see, near as I can remember, it started slowly. I was in my mid-40s when I noticed some problems, and was married for 31 years. But my wife and I, we sort of accepted that after a while. At that point in time, there was really not too many things out there that I knew of that could fix this problem. So I kind of like lived with it, although I did go to my family doctor, who was a relative, and he tried a number of things. He tried testosterone, which didn't work, and then he sent me he said, well, maybe it's psychological, John. So I said, okay. So I said, so we sent me to a psychologist, and I think I went for 2 or 3 sessions with that, to no avail. But that was it. I more or less lived with it, and it got progressively, slowly more pronounced as time went on. I tried the Viagra in a low dose, which was not very effective. Then he tried the higher dosage. I went up to 100 milligrams of Viagra, and still not the result that I was looking for. Then he tried Cialis, he tried Levitra, and now I'm like out of options, He did suggest that that I try injections, but at the time, that did not seem like something for me. I saw Dr. Eid, as a matter of fact, Coloplast's advertisement in the Post. And it's an odd story because I worked with another fellow, okay? My friend Matty, his wife also had passed. We worked together at the telephone company. And one day in the lunchroom, we got into a conversation. And Matty says to me, we were very good friends, and Matty says, I'm having problems. I says, what kind of problems? He says, like erectile problems. And now here I am, a widower, and I want to date, but I'm reluctant to do it because of this problem. So I said, well, Manny, I don't know how to tell you this, but I'm having the same problem. So we more or less broke the ice. Men usually do not get into this type of conversation. So Matty, then I had seen the advertisement in the paper, and we decided to come to one of Dr. Eid's seminars. And we came to the seminar one evening, and it was a winter night. We came up to the seminar, and we listened to the whole seminar. And we decided that this was going to be for us. This is interesting. Now, at the time, I'm 64 years old. I had never in my life had any form of surgery whatsoever. I had never been cut. So coming and getting an implant to me was like, whoa, this is serious stuff. For me, this was a whole new experience, but you know what? I knew I had to do this, and I knew that the outcome was going to be perfect for me. I just knew it. As far as pain, I had been prescribed varying degrees of medications for pain, but I didn't need anything. I didn't need it. I came out of the surgery center in Martin. Matty picked me up. We went out to a diner. We had something to eat. Then he took me home. I went down. I was a little sore, but other than that, every day I got a little better. And after 2 weeks' time, I was walking around. I felt great. After about a week, I came back to see Dr. Eid, and he deflated it, and they took the stitches out. There was only maybe 2 or 3 stitches. I was healing from the second day on. I would say after about 5 weeks, I was told that by Dr. Eid that I could use it. But I gave myself another 2 weeks until everything was healed to my satisfaction. It looked great. It looked great. The deflating, that took me only a few minutes to understand the mechanics of it. Once I saw it and I could work the mechanics of it, it worked perfectly. erectile dysfunction is for men is a nightmare. It's a nightmare because it takes away your whole self-esteem. It takes away the way you feel about yourself. I mean, you always go back and say, you know something, I want to feel like I was when I was in my 20s. And as this erectile dysfunction took hold, it takes your whole feeling about yourself and brings you down somewhat, right? Even if you're an up person, I'm an up person. But after this opened up my world. I'm like a 21-year-old in many respects, not just from the erectile dysfunction. This took my whole confidence level and brought it back up to when I was 21. At this stage now, it's March the 14th of 2008. I had the surgery, and now I'm coming up on almost 2 years. I don't even know that pump is in my scrotum. I don't know. And as a matter of fact, if I look, and I'm a very particular guy. In my car, if I have a scratch on it, I get my airbrushes out and I fix the scratch. And it's got to look as good as can be. And I don't notice, I could not even tell on me that I have this in me. Wouldn't know. I don't see any scarring. As a matter of fact, if I look at myself, I see myself as a 21-year-old. When I look down, I go, I'm pretty proud of this now. My girlfriend, we've been together now for almost 3 years. She knew that I was going to go for this. And she's a 50-year-old, and she's very happy with it. One of the benefits that there is to the implant is that men, myself included, would spend so much time worrying about an erection that it took my mind totally away from the lovemaking, and I was more concerned with, am I going to get an erection, am I not going to get an erection? The chances are I was not going to get an erection. So it kind of ruined things for me. Now, according to her, I'm much more attentive to everything else because my mind is totally into the two of us and the lovemaking. So I'm able to pay much more attention to everything else. I would tell them, I would tell them to do exactly what I did. I would tell them to go to the seminars. I would tell them to go and learn everything they could about erectile dysfunction. And then to find a doctor that was so skilled at doing this, and then to do it. I would not hesitate for a moment. Like I said, it's a funny, the size, the doctors will tell you that this is not to make yourself bigger. But it does make you somewhat larger. I mean, if you're fuller, you definitely would not want to if you went to the gym and you were in the shower room, nobody else is going to stand next to you because you do appear larger than the rest of the guys. It is it's a little known enhancement, but it's subtle, but it's there. And as far as the feeling is exactly the same. I find no difference from when I was a younger man to now in the feeling. The sensitivity is still there. The ability to ejaculate is still the same. It's just, it's a win situation all around as far as I'm concerned. I would do it tomorrow morning. The questions a lot of men ask are, for one thing, does it hurt? And my answer is, there's some soreness, but as far as pain, no. Another thing they ask me is, how long does it take to heal up? And I said, and I tell them, I guess everybody's different. In my own case, I gauged myself. I says, something, when I'm ready, I'll know it. And I was ready 5-6 weeks down the road after the operation. was great. It was great. I can't say enough about it. If you have erectile dysfunction, I would not hesitate to get a penile implant. The three-stage implant that I have is perfect. It's totally inside the body. You cannot notice it whatsoever. Nobody would know you have this. I would do it in a heartbeat. For me, there is no more erectile dysfunction. And I would tell them, you know something, you'll be as good as your best day. If you can remember back to your best day, you'll be as good, if not better, with it. It's just the way it is.